Hi, my name is Neil Korman. I'm a professor of dermatology at Case Western Reserve in Cleveland, Ohio, and I serve as the director of the Scientific Advisory Board for Immune Pharma, helping them develop and learn about new drugs and therapies that are in the scope for autoimmune diseases affecting the skin.
So there's some advancements when it comes to atopic dermatitis, eczema. Tell us about it.
Sure. So atopic dermatitis, very common skin disease that we see every day in the clinic, much more common in children than in adults, but there's a lot of new exciting things going on. I think atopic dermatitis is a tough disease to treat, but with new advances and approaches in biologic therapies, I think there's going to be a lot of new things coming on the horizon.
Atopic dermatitis, what are some of the new things we can expect?
So the role of biologics in atopic dermatitis is just beginning to be developed. There's a particular drug that's in trials that was published recently called dupilumab, which is an antibody directed against IL-4 and IL-13 that looks very promising in clinical trials. And Immune Pharma has a drug called berdalimumab, which is an anti-eotaxin-1 antibody, which looks very promising and very exciting as well as a biological approach to the treatment of eczema.
Berdalimumab, pretty exciting stuff. Tell us your feelings on what's happening here.
Well, I think atopic dermatitis is a disease that we look at as being immune-mediated, and we know that eosinophils play an important role in atopic dermatitis, and we know that berdalimumab, a molecule that blocks eotaxin-1, a molecule that's critical for signaling of eosinophils out in and out of the skin, is a way to block eosinophil migration, perhaps, and so I think it's a very exciting area to be looking at.
Topical drugs, there are new options out there?
Sure. So the standard for treatment of atopic dermatitis are things like topical corticosteroids, topical immunomodulators, but there's a new development that Immune is working on, which is a topical cyclosporin. We know that orally cyclosporin is a phenomenal drug. It's probably the best therapy we have, but it has a lot of toxicities. So using a topical cyclosporin could be a real game changer.
Skin autoimmune disease, there are clinical trials going on right now. What's happening?
So when we say when you say skin autoimmune disease, I'm really thinking about autoimmune blistering diseases. And there's a few of those. The one I would concentrate on at the moment is bullous pemphigoid. Bullous pemphigoid is a disease of the elderly. The patients make an antibody against a molecule at the skin basement membrane, and eosinophils play a critical role in the pathogenesis of this disease. And berdalimumab, which is a biologic that blocks eotaxin-1, critical for signaling of eosinophils in and out of the skin, looks to be an extremely exciting and novel approach to the treatment of this disease that could potentially be steroid sparing.
When we're talking about autoimmune blistering and a lot of what we're seeing out there, there's still some challenges with how it's being taken care of. Explain.
Absolutely. So the standard of care for bullous pemphigoid in this day and age is oral steroids plus or minus an immunosuppressive agent. Oral steroids have enormous numbers of toxicities, from increased risk of diabetes and high blood pressure and osteoporosis and osteonecrosis, all kinds of bad, evil things. And so we would love to get people off corticosteroids and get them onto another therapy, something such as berdalimumab, that doesn't appear at this juncture to have those types of toxicities whatsoever.
We're talking about new topical approaches. So psoriasis, is there one that we should know about? It's being worked on?
Sure. So psoriasis has had enormous gains in the last 10 to 15 years in the treatment of systemic disease, whole body disease, with multiple new TNF blockers and other cytokine blocking agents, but really minimal advances in the approach to topical treatment for psoriasis. Topical cyclosporin, which seems to be coming down the pike, is enormously exciting and could again be another game changer.